According to heart.org, 70% of cardiac emergencies occur and people feel helpless as to what they need to do. And the sad part of that is that 88% of these cardiac emergencies occur in one's home. So simply put, the cardiac emergency will happen to one that you love or care about. And it is important that you know how to do CPR in these situations. American Heart Association recommends that everyone learns how to do CPR because it's far better to do something than to do nothing. CPR can be something that saves your loved one's life. So the first thing to do is when you see someone unconscious, you want to tap them on the shoulder or gently tap their face and ask them, "Are you okay?" And if you don't get any response, that's when you need to gather your AED, if you have it, and hook it up to them the way that the directions tell you. And if it tells you to go ahead and shock them once, then you would do that. And then a good way to remember what to do in CPR is to remember the acronym CAB. So compressions, airway, and breathing. So the very first thing that you want to check after that is compressions. That's what you would start. And the rate that you would do compressions is 100 compressions per minute. And you would do 30 of these compressions. A good song to go by to the beat is Another One Bites the Dust. So the first thing you're going to do is place your palm between the two lungs, and you're going to place it down and place your other palm over it. And you're going to put your shoulders directly above your hands and make sure that your elbows do not buckle. You want them to be locked at all times. That way that you can get as much force as you can. And so you would do it to Another One Bites the Dust. So nine, 10, 11, 12, 13, 14, 15, 16, 21. Okay. And then after that, the very next step is to check their airways. So you would do the head tilt, chin lift method. So you would put your palm on their forehead and lean it back, and then use this to tilt the chin up so that you can get the airway open as much as possible so you can do the rescue breaths. You would use your two fingers to firmly secure the nostrils so that no air would come out that, and you would open the mouth and make sure that your mouth is completely sealed with theirs so that all of the breath will go into theirs. And so when you do 2 breaths, you would check and see if there's any movement in their lungs to see if the air is working. And if not, you would go on to do another set of compressions. So another set of these and another tilt chin lift, and do 2 more. After you have done this, you would have 30 compressions plus 2 breaths equals 1 cycle. You would do this 5 times, and when there isn't any, when you've done it 5 times, you would make sure and see if they've changed any, if they have any air coming through them, or if there's an emergency person nearby, you could have them go ahead and take over now. And that is how you would do CPR.